Lying in. Historical note: the germ theory of disease causation became widely accepted by the medical establishment by 1900, but as early as the 1840s, Ignaz Philipp Semmelweis, a Hungarian doctor, 1818 to 1865, who studied in Vienna, Austria, showed that hand-washing by physicians between their visits to delivering mothers could prevent deaths from lying-in sickness. Born, then home but not home from my first hospital. Dawn's first light shone in the windows of my new life from my grandmother's dark-circled eyes. Her kindly, apprehensive face became for this child an ancient full moon, my guiding celestial constant. Through my first 3 weeks she tended me and waited for word, ran to my cries, hovered above my makeshift bed, so often sighed, marking time. As yet, no news about my mother. My birth mother, only a whispered name, a stranger under constant care herself for weeks for a condition that no woman in a hospital maternity ward in 1946 ever should have contracted, lying-in sickness. At Bushwick Hospital in Brooklyn, New York, 122 beds for the urban poor. That place, my first hospital, came close to killing my mother. I still wonder at the arrogance of some doctor, perhaps Dr. Irving Briller, the name in my baby book, an attending staff physician at Bushwick, with an office just 1 block from our walk-up tenement in the teeming black and white immigrant streets of post-war Bedford-Stuyvesant. Or was it a nurse known only as Scotty? Or some other suspect? An apparent healthcare professional, nameless in the shadows, secretly in contempt of these shabby young women, all their booming, red-faced post-war babies. Someone who simply could not be bothered, refused to waste time washing up between such patients. Who really reaches out what should be helping hands, instead spreads deadly contagion. This infant could not understand then, but because someone in my first hospital nearly killed my mother, when cancer took my grandmother 8 years later, my primary bond was broken. I cried for hours, like a baby. Now please tell all hospital personnel plain, change your new nitrile gloves every time. Or more bluntly put, wash your hands, mother effers.